When you bring your loved one to an emergency room, you expect them to get a bed and be treated and cared for in a timely manner. Well, that wasn't happening when we first brought you the stories last month of elderly patients, some waiting up to 4 days on a gurney in a hallway at Trillium Hospital. Well, nearly 2 months later, that situation has not improved. In fact, it might be getting worse. Premier Kathleen Wynne went on a tour of Trillium Hospital today, then fielded some questions from staff and CEO Michelle D'Emmanuel. She acknowledged many of the province's hospitals and the healthcare system as a whole need some serious work, and agreed something has to be done about the chronic bed shortage at Trillium.
I do not need to be convinced that this hospital and this system needs a rebuild. I don't think we've been creative enough about that continuum. So yes, we need more long-term care. Yes, we need more community care for people in their homes. But we've got to figure out that interim, that sort of continuum.
It was an absolute nightmare.
For Nicole Schmidt, the Premier's words are little more than lip service. CityNews brought you the exclusive story last year of her 80-year-old father, who was stuck on a hospital gurney in the Trillium Emergency Department for 4 days, at which point he left. She says fixing the bed shortage is one thing, but something needs to be done immediately to improve the conditions in the ER.
He was completely ignored the entire time that he was there. Nobody was taking care of his hygiene needs. Nobody was helping him with his food. He was too weak to manage with his food tray. Nobody came in to check on him. There needs to be personal support workers, even some comfortable beds, pillows. There's no pillows in the entire department.
Trillium CEO says something is being done. $10 million was recently infused in the hospital to open up surge beds, and there's funding for 220 new long-term care beds to be built in the near future. In the meantime, the bed shortage continues.
Today, we are in surge, and there are patients who are waiting for a room in the hospital, absolutely. At Trillium, we care for almost 1.6 million patients every year. And one of the things we are working on with the government is new capacity, new hospital bed capacity in this community.
Nicole Schmidt says not enough is being done.
I feel like the Premier and the CEO should spend 4 days on a hospital gurney in the ER and then come back and discuss whether or not there's a problem and see how they feel about their treatment.
Now, Ontario is in the process of trying to negotiate a new health accord with the federal government that would see an increase in federal transfer payments. But they're far apart on just how much of an increase that would be. Premier Wynne said today the federal government's proposal of a 3% increase is unacceptable.